We have been detailing the various speed bumps for the president's health care law the past few days and weeks. So what are all the delays and problems really costing you? White House correspondent Wendell Goler looks for answers tonight.
Obamacare critics are complaining the year-long delay in the requirement that businesses with more than 50 workers provide insurance will wind up costing the government money because those companies that don't provide insurance next year won't have to pay a penalty for it.
Well, the Congressional Budget Office has previously said that the employer mandate would raise $10 billion in revenue in 2014. That money is obviously gone by the wayside.
Republican congressional leaders have asked the CBO if the delay in the employer mandate will raise the cost of the Affordable Care Act, but the CBO hasn't said yet. Supporters say in the long term, Obamacare will save money.
This transition policy does not change the fact that the Affordable Care Act will reduce the deficit by over $100 billion over the next 10 years. This is more than fully paid for.
At the White House, officials say the claim that the delay raises the cost of the law is part of a sabotage effort.
The House Republicans who are driving this narrative are not concerned about a delay in the implementation of a law that they oppose. They want to kill the bill.
Jay Carney says if Republicans wanted to fix parts of Obamacare, they'd offer alternatives. Senator John Thune says what's driving the effort to repeal the law is that so many parts aren't working.
And the House is going to vote this week on delaying the individual mandate for a year. I support that. We're talking about permanent delay. We'd like to see the thing delayed completely for everybody.
Other lawmakers disagree with Thune, but it's hard to argue there is no confusion even about how the administration is buying time.
The point is that the mandate was not delayed. Certain reporting by businesses that could be perceived as onerous, that reporting requirement was delayed.
A Treasury Department blog posting makes clear the mandate is being delayed. It contains no warning about not insuring workers, instead saying, quote, during this 2014 transition period, we strongly encourage employers to maintain or expand health coverage. All but about 6% of the companies covered by the insurance mandate already provide insurance for their workers, but part of the reason for the delay is finding a way to determine whether the insurance they provide meets the standards of the Affordable Care Act. Brett?
Wendell Goler live on the North Lawn. Wendell, thank you. A federal appeals court in Virginia has rejected a Christian school's bid to overturn Obamacare. Liberty University claimed the law violates its religious beliefs. Liberty's lead attorney tells Fox News the school will appeal to the U.S. Supreme Court.